All right, so thank you so much for joining us. We have a wonderful webinar this morning supporting individuals with intellectual disabilities, presented by Maya Evans, school psychologist with KUMDC.
Awesome. Good morning, everybody, and welcome to today's webinar. I look forward to presenting some information for you guys. As Cheney just mentioned, I am a school psychologist for KUMDC, and I look forward to sharing some ways that you guys can support individuals with intellectual disabilities. Looks like we have a poll that just popped up here. If you guys could please indicate which county you work or reside in. And also, if there's anything in the chat, can Rita or Cheney please tell me, because I can't see it if there's at any point. All right. Let me move this poll out of the way. Okay, so today, some learning objectives here. I want you to understand how intellectual disability impacts individuals in their different areas of development. This is by no means, after this webinar, that you can go and diagnose individuals with intellectual disabilities. That is not the goal for today. It's just so you can be able to understand some of the discrepancies that I see when I'm working with individuals who are working with individuals with intellectual disabilities, just some discrepancies. It's just to clear up some of those, to get your questions answered, and to talk about how that disability impacts these individuals. And so increasing awareness, as well as some of the challenges and strengths of these individuals, that you can help support them with some practical strategies we'll go over today. All right, so let's get into it of what an intellectual disability is. So there's three things that, if we're going into what I do of diagnosing this, is looking at the diagnostic manual, and these items will be in there. Just want you to be aware of them. So the biggest and most distinct thing of an intellectual disability is that there's a deficit intellectual functioning. There's an impairment in this individual's reasoning, problem solving, planning, abstract thinking, judgment, and learning. So these are significant difficulties that are below the average person, right? And this is looking at in comparison to their same age group. And so what you might see in this area, especially those of us that are working directly in the schools, is you may have they maybe have those basic concepts of learning, but once you start to have to apply them to different contexts and to be use that abstract reasoning, you may find that they have difficulty with that. And then the other big deficit is in adaptive functioning. And our adaptive skills are those that you're able to use on a day-to-day to help with our independent functioning. So you may see impairments in communication, social participation, which we'll get into a little bit more, to not be confused with autism spectrum disorder. But particularly those independent living skills across multiple environments, that's where we see a big deficit in those individuals with intellectual disabilities, that they have trouble navigating the community, navigating different spaces that they aren't familiar with, being able to complete tasks on their own, to money management, to things like job skills. And these individuals need extra support in those areas. And then particularly, it's important to note that this is before the age of 18, that the onset. So if we're looking at something beyond the age of 18, maybe you're talking with someone that is 30 something, and they're saying, I just started to feel like I have difficulties in these areas. We would want to look into referring to someone like a neurologist or something like that, where you might see more of a medical condition if this was not a problem or issue before the age of 18. So that's important to note. We'll get into these a little bit more. So specifically, when we're looking at the cognitive profile of someone with an intellectual disability, these are the things you may notice. They have a slower learning pace. They have difficulty with that problem solving, reasoning, memory difficulties, and limited generalization skills. So as I mentioned, this individual, let's say they are 10 years old and they're in your classroom. They may have difficulty being able to read or do problem solving skills for math beyond a kindergarten level or something like that, that they need they have difficulty with being able to memorize and then apply things across one context. They may have learned it how to do it this way, but they may have difficulty learning how to do it in another way and generalizing that information. Okay. You may also see they have delayed language development. And again, these are not exhaustive lists, and they are also not applicable to everyone, but these are what you might see in general. And expressive language challenges in particular, that they may have difficulty being able to express in their essays, in their writing. They may have difficulty expressing things a certain way. Say you don't understand them the first time, and then you ask, can you repeat that or explain that a different way? They may have difficulty doing so. And they may also have difficulty understanding what you're saying and being able to process some of that information, and may need it explained multiple times in order to understand. And then here's one where it may often get misconstrued. And this is maybe how you first notice someone with an intellectual disability, especially outside of a academic setting, because what they're realizing is that they're different and not able to navigate the community and navigate the world as easily as they may see others can do. And so that's difficult. And they know that they are not able to do so. So it's frustrating. So you may see that these individuals have difficult managing emotions. They may be irritated. They may be frustrated. They may be impulsive because they are thinking like, I don't know how to do that, so I'm just going to do what everyone else is doing, or do the first thing that comes to mind, and it may not always be the best decision. And then because they're not able to generalize as easily, they may prefer sameness and repetition. So that's where we kind of get into in a moment of the differences between autism, because that is something that you may also see there. But here, that preference for sameness is because it's not a nuance. It's because they don't know how to generalize to other contexts. So it's just, I prefer this because I can have greater potential to excel in this environment because I already know it. And then adaptive functioning, one of the biggest things here is being able to do self-care tasks and daily living tasks. So being able to keep up with hygiene, being able to brush your teeth, wash your hair, to cook and to clean, things like that, these individuals may struggle with on a daily basis. And then multi-step instructions in particular, you tell this child to go get the marker from the board, then to do this task, then to do this task. They may only remember one of those three. And just being able to follow multi-steps is challenging sometimes for these individuals. Having limited awareness of safety and danger is a big one as well. Some of our students with intellectual disabilities, we may find that they don't necessarily familiar with stranger danger, or being able to, they just may see people as friendly, or they may not be able to distinguish that decision of that maybe I shouldn't go with this person, or maybe I shouldn't do this. They just are oftentimes, what I'll hear is they just want to be, they're excited that someone's talking to them and treating them like an adult, because often they are treated less so like a child. And so I see this with, especially in the high school settings where our students with intellectual disabilities are just excited sometimes that another adult is talking with them and treating them as such. And then also just managing those responsibilities that I mentioned earlier, that money management and doing chores. And particularly, these individuals may have difficulty in a job in a job that requires multiple skills and abstract thinking. That can be challenging for them. Okay, and then our social skills, that limited social awareness, difficulty forming and maintaining friendships of their same age, and then being overly trusting and unaware. Kind of mentioned that a bit before. And now let's get into, how is this different from autism spectrum disorder? How, when we see both of these individuals in a room, what are the similarities and differences that we might see? So we already talked about the similarities in that those social difficulties, the preference for sameness, but really how do we distinguish? Again, this is not diagnostic, but just for, as you're working with these individuals, to know some of their potential for those with intellectual disability. So as I emphasized before, the core deficit in intellectual disability is that intellectual functioning and adaptive skills. For those with autism spectrum disorder, you do not have to have an intellectual disability. They may, in fact, be gifted in some areas, that they do not have to have a deficit. I think that's a common misconception, is that individuals with either of these disorders must have intellectual deficit. That is only the case with intellectual disability. And so you may see this when you're looking at their IEP, or you're looking at some former psychological testing, that their cognitive functioning would require an IQ below 70 for an intellectual disability. You may see that in their paperwork or whatever the case may be, but that you do not have to see that for an individual with autism spectrum disorder, and their IQ or cognitive functioning can range. When it comes to language development, it is delayed or can be delayed in those with intellectual disability, but you will see more commonly that in autism spectrum disorder, those with the language delays and having some of that atypical speech. So they're the commonly repetitive echolalia, or having difficulty with that pragmatic speech and language. Social awareness is another key distinction when we're thinking about getting into how these individuals function with others. They may engage in intellectual disability. They can engage socially. They can have friends of their same age, but it's just sometimes with those complex reasoning and problem solving and doing typical, especially when you start to get into high school, going into do different social settings, they may struggle, and they're often, you may see them more anxious. You may see them trying to act out and in different areas, just to kind of to manage and to take away from or distract from their deficits. Um, with autism spectrum disorder, on the other hand, they aren't aware of those social norms and having difficulty with personal space. And a big one is those nonverbal cues. An individual with intellectual disability can make eye contact, and they can have some of that nonverbal communication, whereas with ASD, that is a big challenge for those individuals. Both may show repetitive or restrictive behaviors, but again, in intellectual disability, that's more so just because they are unable to apply it to different contexts. But you could teach them, and that it would be able to do so. With autism spectrum disorder, it's going to be a constant repetitive and restrictive behaviors, and commonly due to preference or to sensory adjustment and things that they prefer due to sensory reasons, not because of intellect. Then both may also struggle with adaptive functioning, but particularly intellectual disability will be in some area as a requirement of this disability. So you may have difficulty with personal care. Most commonly, I see personal care and definitely money. And then those independent living skills are going to be challenging. And so that's an area for support, which we will go into next. And then also the emphasis on structure. Both may have the opportunity to thrive with routine and learn best with repetition. But when it comes to intellectual disability, that is because of that difficulty in generalizability. And then when it comes to autism spectrum disorder, it's more due to those sensitivity preferences and their rigid thoughts. Any questions on these differences? And does that any need any more clarification on the differences between intellectual disability and autism spectrum disorder? All right. So, how do we support these individuals with intellectual disabilities? As we now know that some of their difficulties and challenges, how can we turn those into, how do we support those individuals in their challenges? So, learning well through repetition and hands-on experiences, that is a potential strength of theirs. So it requires our extra patience, but being able to increase that repetition, encourage them to ask questions and to ask for help and to ask for it to be explained in another way. And then also hands-on learning is an opportunity for a strength in these individuals, and being able to provide different methods of learning and not just verbal responses. So you may find that these individuals do well with kinesthetic learning and having different materials to use to learn. And especially as you get, so those are for our younger individuals. And then when we get into high school, providing opportunities for different ways to learn. Maybe we're going to use mnemonics and chunking and different things that help them to retain that information better. We're getting into the procedural memory or memory of personal experiences is an area of strength for these individuals. They can often be able to tell you about, what their family trip was last week, and being able to tell you about how they ride their bike, or some of those memories and materials that are very straightforward and that are personal to them. Encourage them to tell you about their weekend, and that gives an area of strength for them and to increase their expressive language. They are often eager to engage in social interactions in familiar and supportive settings, and we need to provide that for them. So, providing that supportive setting and where they don't feel afraid to ask a question, they don't feel afraid to be a little bit different, and encouraging that engagement. And then having that structure and predictability, having our classroom routines, if we're working with them in a more of a work setting, having them with a certain job and knowing exactly what they need to do at home, providing them with a list of the chores, and before when you initially give them that list, going through what each chore looks like and how they would be able to do that. And they often can have the strength and potential for a strong work ethic in those repetitive and structured job roles. And we need people in these roles. So roles like a cashier, working at the front, when you are able to um especially in particularly now, there's a lot of places that are just like card readers and at the cashier position. So something like that, that all they do, the customer has the card, and then all they're doing giving the receipt. Things like where you are helping them with, they're doing like something like stocking the shelves, something that is a repetitive and structured job role that they are able to do. um Particularly though, if it's a cashier setting where there's more of that money manager, they're having to give back having to give back change and things like that, would be a little bit more challenging. But if something that is more procedural, just a couple of steps that is involved in the job, that would be more ideal. And we can do this in the classroom as well or at home. Just really showing that structure and repetition can help support these individuals. Okay, so let's build on these strengths to support challenges. And with the cognitive and communication needs in the classroom, using those hands-on materials we've mentioned, being able to break down tasks into small step-by-step instructions, using simple and direct language. Visual supports is also a great one, whether we're in the classroom setting, at home, or in the workplace. Being able to have visual reminders of the task steps, visual reminders of what they need to do for the day, anything like that that can help just to trigger that memory. Allowing repetitive practice and real world examples, even in the classroom setting. A lot of these individuals will benefit from first having that practice in the classroom or home setting prior to going out into the real world example, because it starts off with somewhere that's familiar, with people that they trust and are familiar with. And then they go into that setting and they'll need some help with that transition into the real world, and being able to work with others and different environments. And then, of course, being patient and allowing extra time for that processing, which is an area of difficulty for them. Okay. When it comes to behavior and their adaptive functioning, using role playing or social stories to help teach those social norms and decision making, providing step-by-step instructions, especially for personal care. There's a lot of things that we may find are like would be automatic, or that we would think most people would know. When it comes to our personal care and hygiene, these are things that need to be emphasized for individuals with intellectual disabilities and difficulties with adaptive functioning. Just emphasize it, and then also do so in a respectful way, and not to diminish their ability or make them feel bad for not knowing, to encourage them to ask questions, and that it's okay that they have a difficulty in this area, is important to just help with their confidence, because I'll see a lot of times also that are having difficulty with their confidence because they feel they are different from the typical person their age. Alrighty, and being able to teach and monitor use of coping strategies for emotional regulations. This may provide the support of, say, you're a teacher and working with the school psychologist or whoever your mental health staff at the school, being able to help with those coping strategies for when they do feel frustrated, when they feel irritated, how to be able to healthily release some of that emotion. And then addressing any behavioral challenges with consistent strategies and clear expectations. This is, like I mentioned, where you may see some of these individuals having inappropriate conversations or interactions where they may not initially understand. And so approaching it in that sense of first explaining why that is an inappropriate or maladaptive behavior, and getting with someone like our behavior analyst to work with strategies and expectations for that. And then, of course, being able to have a positive behavior reinforced. Okay. So in conclusion, if you don't take anything else from this presentation, is being able to understand that individuals with intellectual disabilities have unique challenges, and particularly in the area of intellectual functioning and adaptive functioning. And it requires and may require lifelong support in certain areas, but can improve with the structure and repeated practice. And when we're thinking of that difference between ID and ASD, that while both have some developmental delays, that ID has that intellectual or cognitive delay, and then ASD is more so with social communication, rigidity, restrictive behaviors. And then finally, just to summarize everything here to help support our individuals with intellectual disabilities, that repetition and hands-on learning through structure and practical experiences, predictability to support success, those clear routines they thrive with, and being able to reduce the anxiety and build on their confidence, encouraging social engagement. Don't want to have these individuals isolated, but being able to support interactions in familiar settings, fostering independence by teaching this self-care and life skills with guidance and then repetition in order to really solidify those skills, using positive reinforcement to increase motivation, and then remembering that small, consistent efforts lead to long-term progress. Any questions? And there's nothing in the chat, right? I can't see.
I'm not seeing anything in the chat, but thank you very much, Maya. That was a very interesting presentation.
Awesome. All right, you guys.